Hey, the Harris Health System recently cleared a big hurdle in getting approval from its board to ask voters to approve $2.5 billion in bonds. That included in that will be enough to build a new LBJ Hospital to replace the one that is 33 years old, and millions for renovations at Ben Taub Hospital. So why is that needed? Well, I've got just the guy to answer that question for us. Dr. Esmaeil Porsa is president and CEO of Harris Health, joining me this morning. This is a very big deal for you, isn't it?
It is. First of all, thank you for having me here. It's an honor. It is a big deal. You know, a lot of the viewers may not know this, but I actually did my training in internal medicine at Harris Health System many years ago, a couple of years after the LBJ opened its doors. And I always tell people that at that time, LBJ Hospital was too small. And since then, the population of Harris County has actually doubled, now close to 5 million people. And unfortunately, you know, we also have the highest number of uninsured, highest rates of uninsured in the country. Nothing to be proud of. I'll say all those things to emphasize the fact that replacing the LBJ Hospital, building a hospital with a higher capacity and more capabilities in terms of services that it can provide is much needed.
So building a new one instead of fixing it is the option?
Correct. Fixing it is cost prohibitive. As you just mentioned, the hospital was built more than 30 years ago. To bring it up to today's standards and the codes would be cost prohibitive, and it will not still provide the services, the additional services that we need. Case in point, today, somebody with an acute stroke or acute heart attack walks into the LBJ Hospital, the busiest level 3 trauma center in Texas, will have to be stabilized and then transferred somewhere else because we currently cannot provide those services. That is the only hospital in the northeast quadrant of Harris County.
So let's talk about the plan now to build a new hospital. I understand it's to build it on the same property.
That is correct.
That the existing hospital. Why go that route, and what does that mean for the services at the current hospital, since you're planning on keeping that current hospital running while you're building the new one?
That's actually the main reason why building it on the same place, same location. Two reasons. One, you know, we have the land to do it. As I mentioned, LBJ Hospital is the only hospital serving that quadrant of Harris County, so we want to stay there. That's where we should be. When we look into the future, that's also where the growth in the indigent population seems to be going as well. And as far as the providing the services that are currently not being provided, currently Harris County has two adult level 1 trauma centers, Ben Taub Hospital and Memorial Hermann Hospital, both in Texas Medical Center and attached to each other. LBJ Hospital, the future LBJ Hospital, would be the third adult level 1 trauma center in Harris County and the first outside of the Texas Medical Center, really providing the service to the residents of the county that currently does not exist.
And it seems to be that that's kind of a crux of a lot of this. The demographics of this community have been so diverse for so long. It's kind of ironic that the area that there are so many people who really don't have wherewithal financially are the ones who are impacted by not having the kind of care that is in other places.
Exactly, and that's, you know, if we didn't learn anything from COVID, it's exactly that point. The demographic, the population that was most significantly negatively impacted with COVID are the population that have the least access to care. And again, going back to your previous question, why build LBJ where it is right now? Because that's where the services are needed.
So among the bond issues are going to be the money for other things as well.
That's
so
correct.
Talk about some of what the other money is going to be going for.
Sure. So in addition to building a brand new LBJ Hospital, we want to refurbish the existing LBJ Hospital to provide some of the services that are currently lacking. For example, inpatient psychiatric beds. This community needs that service badly. The entire community needs it, but definitely the northeast quadrant of Harris County. $400 million towards refurbishing the Ben Taub Hospital, adding to its lifespan for another 10 or 15 years, but also creating a new tower with up to 120 additional med-surg beds, hospital beds, to serve the community. But also almost a $500 million investment in our community, creation of new clinics, expanding the existing clinics and making them more capable in delivering services.
So everything that you've talked about now seems like slam dunk. Who wouldn't want that? But you've got a bond, and you've got to have voters go ahead and chime in on it. What's the process now going forward for getting that bond out there and getting people to understand some of the things we just talked about this morning?
Thank you very much for asking that question. So as you may know, it was in the Houston Chronicles last month, my Board of Trustees, Harris Health System Board of Trustees, unanimously approved the bond proposal. The bond proposal now goes in front of the Commissioner's Court for conversation, discussion, questions, and answers. By law, the Commissioner's Court cannot approve the proposal to appear on the November 7th ballot until August of this year. God willing, that happens. The Commissioner's Court approves the bond proposal. It appears on the November 7th ballot. And then we rely on the residents of the county to think and say exactly what you just said. We need this. This is a slam dunk. Let's support it.
Let's say everything goes really well. How soon would a new hospital be built and open?
The new LBJ Hospital will open in stores in 2028.
Okay, well, it's not too long to wait considering what's been going on up to now, right?
That is correct.
Dr. Esmaeil Porsa, thank you for your service to this community. Thank you for being here this morning and talking about this very, very critical need. We look forward to getting more information and seeing what the Harris County commissioners do about this. No pressure, commissioners, at all.
Happy to come back at any point. Thank you for having me.
Thank you so much as well.